Viraya is 80-year-old. He lives with his 2 sons, daughter-in-laws and grandchildren, all 7 of them in 2 rooms. He has been coughing continuously. He was diagnosed with tuberculosis 3 months ago.
ಏನ್ರಿ ಅದು ನನಗೆ ಗೊತ್ತೇ ಇಲ್ಲದು ದಮ್ ಬಂದಿತ್ತು ದಮ್ ಅಂದರೆ ಇದಕ್ಕೆ ಕೇಕು ಅದರಿಂದ ಏಕದಮ್ಮು ಇದನ್ನು ಇದಂತ ಇಲ್ಲಿಂದ ಇಲ್ಲಿ ತನಕ ಸುಡ್ತೈತಿ ಬೆಂಕಿ ಇದ್ದಂಗೆ ಇದು ತೆಗಿಸ್ಬೇಕು ಎಕ್ಸ್ಟ್ರಾ ಅಂದರು ಅಲ್ಲಿ ಮತ್ತು 100 ರೂಪಾಯಿ ರಸೀದಿ ಕೊಟ್ಟು ತೆಗ್ಸಿಂದ ಅದನ್ನ ನೋಡಿದ್ರೆ ಐತಪ್ಪ ಇದ್ರಾಗ 2 ಸರಿ ಕಫ ಕೊಟ್ರಿ ಅಂತ ಕಫ ಕೊಟ್ಟು ಅದು ಟೆಸ್ಟ್ ಮಾಡಿಸೋ ಕಳಿಸ್ತೀವಿ ಅದು ರಿಪೋರ್ಟ್ ಏನು ಬರ್ತೈತಿ ಆ ರಿಪೋರ್ಟ್ ಇದಕ್ಕೆ ಟಚ್ ಮಾಡಿ ಔಷಧಿ ಕೊಡ್ತೀವಿ ಎಷ್ಟು ದಿನ ಅಂದರೆ ಒಂದು 2 ತಿಂಗಳು ಆಗಿರ್ಬೋದು ಅಷ್ಟೇ 3 ತಿಂಗಳು ಇರ್ಬೋದು 2 ತಿಂಗಳು ಅಲ್ಲಿ ಆಸ್ಪತ್ರೆಗಿದ್ದೆ ಅಲ್ಲಿಂದ ಎಲ್ಲ ಮುಗೀತಪ್ಪ ಇಲ್ಲಿ ಹರಪನಹಳ್ಳಿ ಆಸ್ಪತ್ರೆಗೆ ಹೋಗ್ರಿ ಅಲ್ಲಿ
ದಾವಣಗೆರೆಗೆ ಹೋಗಿದ್ರಾ?
ದಾವಣಗೆರೆಗಿದ್ದೆ ನಾನು ಸಿ ಜಿ ಒಳಗೆ ಐತಿ ರೆಕಾರ್ಡ್ ಅದೆಲ್ಲ ಮತ್ತು ಹರಪನಹಳ್ಳಿಗೆ ಹೋಗ್ರಿ ಹರಪನಹಳ್ಳಿಯಾಗ ಗುಳಿಗೆ ಕೊಡ್ತಾರೆ 6 ತಿಂಗಳದು ಅವು ತೊಗೊಂಡ್ಬಿಟ್ರೆ ಆರಾಮಾಗ್ತೀವಿ ಇನ್ನು ಯಾವ ಗುಳಿಗೆ ಮುಟ್ಟಂಗಿಲ್ಲ ನೀವು ಅಂದ್ರೆ ಈಸೋಗೊಂದದ ಗುಳಿಗೆ ಹಂಗೆ ಇಟ್ಟಿನಿ.
Viraya was uneducated. He had no idea what tuberculosis was and even never heard of it. Neither his family. Nobody has this before him. Only after he suffered from the disease, he got to know about this.
ಇಲ್ರಿ ನನಗೆ ಏನು ಗೊತ್ತೇ ಇಲ್ಲ ನಮ್ಮದ್ರಾಗ ಯಾರಿಗೂ ಇಲ್ಲರಿ ಟಿ ಬಿ ಅಂತ ಟಿ ಬಿ ಅಟ್ಯಾಚ್ ಇಲ್ಲ ನಮಗೆ ನಮ್ಮ ವಂಶದಲ್ಲೇ ಇಲ್ಲ.
As Viraya has TB, his family has taken precautions so that they don't get infected with the virus. He himself wears masks most of the time so that nobody else will get TB from him. Geeta is worried about his father-in-law's health as well her own and other family members. They all live under the same roof with 2 children. They have separated his utensils and they also tell him to cover his mouth whenever he coughs. She's educated but still she didn't know about the TB before his father-in-law was diagnosed with it.
ಎಲ್ಲಿ ಎಫೆಕ್ಟ್ ಆಗಿಬಿಡುತ್ತೋ ಮಕ್ಕಳಿಗೆಲ್ಲ ಎಲ್ಲಿ ಇದಾಗ್ಬಿಡುತ್ತೋ ಅನ್ನೋ ಭಯ. ಅವರಿಗೆ ಟ್ಯಾಬ್ಲೆಟ್ ಎಲ್ಲ ತಗೊಂತಾರ. ನಮಗೇನಂತ ತೊಂದರೆ ಏನಿಲ್ಲ, ನಾವೆಲ್ಲ ಸಪ್ರೇಟ್ ಆಗಿ ಇಟ್ಟಿದೀವಲ್ಲ, ನಮಗೇನಂತ ತೊಂದರೆ ಅನಿಸಿಲ್ಲ.
India is the leading country in tuberculosis. India contributes more than 27% in world's population of tuberculosis. About 1.7 billion people could have latent TB and in future they might develop TB. Every year there are more than 10 million cases of TB. There is only one government hospital in Harapanahally where everyone goes. Patients who have TB or may have TB come here for their treatment and checkups. Tuberculosis in Harapanahally is increasing. In 2011, there were not more than 1,000 cases, but now there are more than 1,500. Dr. Shankar Nayak is a physician and he's the one who treats all the TB patients of Harapanahally and of nearby villages. He says illiteracy and lack of awareness about TB is the main reason behind the increase in the areas.
In PSC level, usually most of the many of the times, doctors will only go to houses and they will search cases and they will come to know where are all the cases are more. Maybe due to some ignorance one, and then illiteracy sometimes, then negligence or ignorance is here, and sometimes they come very late, and sometimes they will be living in small house, contacts will be more. General contacts and they don't come in early stages. Usually they come in end stage. By that time they will spread to so many patients. Most are educated still. Education is not that high. Now for more cases we are diagnosing means investigation facilities are more now. We do sputum, then CB0 machine is there. It is a catheter based gene testing there. So we are diagnosing more of cases. And X-ray, now previously there was no physician. Now I have come since 2 years as I have come as a physician. Most of the patient I will only diagnose. Previously just they used to do sputum examination. Suppose it comes positive or negative, patient was almost declared as hey, you are not having anything like that. Now if they have symptoms, again I subject them to CB0 gene therapy or chest X-ray or some other meningitis, maybe they are TB like that. So till he is diagnosed, till he comes, all his tests comes including meningitis, we subject him for many tests.
There are many others like Viraya. Abraham has multi-drug resistant TB. No medicines are working. He's too weak to even sit by his own. Entire day he sleeps outside his house. The only source of income to his family was the tea stall that Abraham used to run. But since he got TB, there's no income. Somehow the family is surviving. Farheen is 25 years old and is worried about his father's health.
हमना मालूम नहीं था। पहले इनको पेट में दर्द आया, पेट के दर्द से हमें हॉस्पिटल को बुलाने गए। खाना खाने नहीं होता था, क्या दिया तब नको नको कहते। वो ले जा को दिखाने से खाली गैस्ट्रिक प्रॉब्लम है, सो वो मेरे को बोलते थे। बाद फसलें का दर्द स्टार्ट हो गया इनको। 3-4 महीने से फसलें का दर्द होता था, खांसी नहीं होती थी। बाद बुलाने जा दिखाने तब भी नॉर्मल करके बोले। वो हॉस्पिटल से बुलाने जाने से वहाँ बोले टीबी आ गया मेरे को। बाद वहाँ से आपको टीबी का ट्रीटमेंट करने को थे। उसको बैठ सकते नहीं, क्या भी खा सकते नहीं, खाना एक निवाला भी खा सकते नहीं, खाली गंजी पीती। पहले होटल रखे थे, टी होटल। अब कुछ भी नहीं, उठने बैठने से नहीं हुआ तो क्या करती हूँ मैं। ज़्यादा हो रहा है लेकिन कम नहीं हो रहा है।
In 2017, more than 4 lakh people died because of TB in India. Karnataka is in top 10 states in India which has the highest number of TB. More than 8,000 new cases of TB were registered last year. Dr. G.T. Raghuvendrath has started a campaign to fight against tuberculosis in Davangere district. His goal is to make Davangere free of tuberculosis. He is the director of District Hospital of Davangere and also the head of TB control program of Davangere. As the cases of tuberculosis are on the rise, he has set few goals and has plans to eliminate TB by 2030. Along with other, he has made plans and strategies to reach to more and more people.
2025 we have a goal. It is called elimination of TB. We are going from stop TB strategy to end TB strategy. So not only in Harpanhalli, all over India, we are going in the phase of elimination of TB. We are in the pre-elimination stage. On an enumeration, it is said that there will be 217 cases per lakh population per year in India. We have to bring it to as low as 44 cases, less than 44 cases per million, per lakh per year in India. So that is our goal. So overall by 2025, a goal has been set to us from Government of India that TB has to be eliminated.
There are 8 taluks in Davangere district and there are hundreds of villages in these taluks. People living in these areas don't have much knowledge about the disease and also don't have the reach.
So we have increased the process of active case finding campaign. Beneficiaries used to come to hospitals. So we used to subject them for sputum examination. It has become active surveillance. So it is called universal access to free and quality TB care in India. So here what we do is, including the field staff like ASHA workers, Anganwadi teachers and our general health staff, whenever they are in the field, they go in search of patients. If they come across any person coughing or with a history of cough for a period of more than 2 weeks, the person is individually sent to the nearest PSC for sputum examination.
Under the DOTS program, medicines are given to TB patients by ASHA workers, Anganwadi teachers or by doctors. Even in Davangere, DOTS is used to treat patients. But since revised technical and operational guidelines have come up, they started using that instead of DOTS.
Because most of the patients they come from low socioeconomic strata, no nutritious food will be there, most of them will be anemic and comorbidities will be there. The patients will be comorbidities like diabetes, HIV, malnutrition, anemia and liver diseases, gastric disturbances. Due to all these conditions, the patient would not tolerate 7 pills for thrice a week in intermittent regimen. So the Central TB Division and the World Health Organization, they came up with something called daily regimen. Now based on the weight of the patient, there are 4 weight bands: 25 to 39, 40 to 54, 55 to 69 and 70 and above. These are 4 weight bands. So we will, once the patient is diagnosed as tuberculosis, the patient, based on the weight, in which weight band the patient falls, based on this weight band, the patient is fixed as 2, 3, 4, 5 pills. The patient has to take fixed dose combination pills which contain 4 drugs: HRZD, INS, rifampicin, pyrazine, ethambutol. 4 drugs FDCs for 2 months in continuous phase. So after 2 months we do a sputum examination. Patient has become negative once the sputum is converted. So we will start the patient on continuous phase, that is for 4 months, 3 FDC. That will be everyday dosage including Sundays. So after 4 months, end of treatment follow-up sputum examination is done. When that examination comes out to be negative, the patient is declared as cured.
Explaining the whole procedure of DOTS, Dr. Raghuvendra said,
DOTS means the full form of DOTS is directly observed treatment, short course chemotherapy. Patient was supposed to come to the DOTS center. Once the patient is diagnosed, we will do counseling. The medical officer will counsel the patient. The patient is asked a question, from whom would you like to take the treatment from? So the choice is given to the patient. The patient might give many options. The patient might opt for the doctor himself. The patient might opt for a ASHA worker. The patient might opt for an Anganwadi teacher or a healthcare provider who is in his or her near vicinity. So we will call the DOT provider. The medical officer will explain about the patient-wise box treatment. And in front of the DOT provider, the patient has to swallow tablets. So a TB treatment card will be there. So all the regimens, whenever the patient has taken the regimens, treatments, a tick mark will be done on the TB treatment card. So now the DOTS activity is revised a little bit. Now since it is daily regimen, so it comes in the form of 28 blister packs. So each patient, based on his weight, we will give 2 or 3 strips to the patient.
There have been many cases where the patient's body just stops reacting to the medicines that were being provided to them. And all over the world, there are more than 5 lakh people who have drug-resistant TB, and India contributes 20% to this. In Davangere, there are 60 cases of drug-resistant TB. Over a time in Davangere, they have treated around 120 cases of multi-drug-resistant TB, and right now they have 55 cases of multi-drug-resistant TB. In places like Harpanahalli, people don't know about it, which is the main factor behind the increase in the number of patients. Treatment is free of cost and it's available, but still millions die every day.
Tuberclosis ಪ್ರೋಗ್ರಾಮಿಗೆ ನಾವು ಅವೇರ್ನೆಸ್ ಅಂದರೆ IC ಎಲ್ಲ ಮಾಡ್ತೇವೆ. IC ಮತ್ತು ಇನ್ಫಾರ್ಮೇಷನ್ ಎಜುಕೇಷನ್ ಕಮ್ಯುನಿಕೇಷನ್ IC ಅಂತ ಕಾಂಪ್ಲೆಂಟ್ಸ್ ಎಲ್ಲ ಕೊಟ್ಟು ಅದೆಲ್ಲ ಮಾಡ್ತೇವೆ. ಅದು ಮೇಲೆ ಈಗ ರೀಸೆಂಟಾಗಿ ನಾವು ಲಾಸ್ಟ್ ನವಂಬರ್ನಾಗೆ ACF ಅಂತ ಮಾಡಿದ್ವಿ. ಆ್ಯಕ್ಟಿವ್ ಕೇಸ್ ಡಿಟೆಕ್ಷನ್ ಇದು ಫೈಂಡಿಂಗ್ ಇದು ಅಂತ ಅದು ವರ್ಷಕ್ಕೆ ಒಂದು ವರ್ಷದಲ್ಲಿ 2 ಸಲ ಮಾಡ್ತೇವೆ. ಎಲ್ಲೇ ಭಾಳ ಸ್ಲಮ್ ಇರುತ್ತೆ, ಎಲ್ಲೇ ಭಾಳ ಟ್ಯೂಬರ್ಕ್ಯುಲೋಸಿಸ್ ಕೇಸಸ್ ಬರ್ತಿರ್ತವೆ ಅಂಥ ಏರಿಯಾದಾಗ ಆ್ಯಕ್ಟಿವ್ ಕೇಸ್ ಡಿಟೆಕ್ಷನ್ ಕ್ಯಾಂಪೇನ್ ಅಂತ ಮಾಡ್ತೇವೆ. ಅದು ವರ್ಷದಲ್ಲಿ 2 ಟೈಮ್ ಮಾಡ್ತೇವೆ.
Their aim is to eliminate TB by 2025. Their motive is to make the people familiar with TB and then treat them. They should know what are the symptoms and what is the treatment for this. The goal of the world is to make the world TB-less by 2025, for which they have started so many schemes already all over the world. But still, it's a long way to go. There are people like Firea who would have never got infected by this or would have taken precautions of TB, but they didn't have the idea. Educating children in schools and colleges would help the situation. They should be taught what is TB and how it could be prevented. Then they will tell their elders, and this is how awareness will spread. Everyone needs to be careful for their own health. Consuming alcohol, chewing tobacco, etc. would be controlled. Children should be taught what TB is, its symptoms, causes, treatments, so that they could tell their parents and others who didn't know about it. Fareen has left all the hopes. Her father has TB, but her whole family is suffering. She doesn't know when her father will be fine again and when her family's condition will get better.
हमें क्या भी मालूम नहीं कब तक होता है क्या, उठते बैठते नहीं तो क्या हमें उम्मीद रखी है। बहुत तकलीफ है हमारे घर में।